All right, everybody. Today we are doing a deep dive into something that I think will resonate with probably everyone at some point in their lives,
Oh, yeah.
and that is back pain.
Everyone's had it.
Everyone's had it. We're talking specifically about lumbar disc herniation today,
Okay.
and we are very fortunate to be joined by the expertise of Dr. G. Katsevman,
Yes.
who is a neurosurgeon and spine surgeon down in Florida. And he has got some really interesting things to say about lumbar disc herniation.
For sure.
So whether you are dealing with this yourself right now, maybe you know someone who is, or you're just curious because you know at some point you're probably going to have back pain too, this is the deep dive for you.
Absolutely. And one of the most reassuring things that I got from his insights was that not all disc herniations are the same.
Okay.
You know, you hear herniated disc and you think, oh my gosh,
This sounds
surgery.
like debilitating. Like,
Yeah.
this is a really serious thing. And maybe it is, but it sounds like it's not always as scary as it sounds.
Yeah. Right. And I think that's a really important distinction to make because I think when people hear medical jargon and they're not familiar with it, it can be very frightening. And
Yeah.
then they start to catastrophize and think the worst case scenario.
Absolutely.
But he really emphasizes that, this is a very common condition. It's a normal part of aging for a lot of people. And the severity really varies depending on a lot of factors.
Okay, so like what kind of things are we talking about when we say that not all disc herniations are the same?
Well, just like anything else, there's a spectrum,
Okay.
right? So you could have a very tiny little herniation
Mm-hmm.
that's essentially asymptomatic,
Okay.
or you could have one that's very large and causing significant pain and neurological symptoms.
Okay, so it depends on the size of the herniation. What else?
The location is very important
Okay.
because a herniation in one part of your spine might cause very different symptoms than a herniation in another part of your spine.
That makes sense.
It also depends on, how your body reacts to the herniation.
Interesting.
So some people,
So like some people maybe have a higher pain tolerance. Oh,
exactly,
huh,
or their
okay.
body might be able to compensate better.
Okay.
Or the herniation might be pressing on a nerve in one person, but not in another person.
Right.
So there's a lot of individual variability.
So it's not as simple as saying, oh, you have a herniated disc, this is what it means, and this is what we're going to do.
Exactly.
Okay, got it.
It's very patient specific.
And what's interesting too, and this kind of blew my mind a little bit, was that he's seen even large herniations resolve on their own over time.
Which I thought was fascinating
Oh,
because we think of, a herniated disc, you're thinking, oh my gosh, surgery,
Oh,
like we were saying.
right.
But he said that it's not uncommon for the body to actually heal itself.
So it's kind of like our body heals itself from like a cut or a broken bone.
Exactly.
Interesting.
Your body has an amazing capacity to heal.
Okay, that's good to know. That's reassuring.
So he doesn't always jump to surgery right away. He really tries to exhaust all other options first.
Which makes sense because surgery is a big deal.
Right.
Yeah.
It's a big decision.
Yeah, absolutely.
And it's not without its risks.
Right. So when does he say surgery is necessary? Like, what are the red flags?
So he's very clear on this, that it's not just about the level of pain,
Okay.
right? So you could have somebody who has a very large herniation
Mm-hmm.
and they're in a lot of pain, but they're still able to function.
Okay.
They can still walk, they can still go to the bathroom,
Mhm.
they can still do all the things that they need to do.
Okay.
But then you could have somebody else who has a much smaller herniation,
Right.
but it's pressing on a nerve in a way
Mm-hmm.
that's causing significant neurological symptoms.
So it's more about how it's impacting your ability to live your life.
Exactly.
Oh, yeah.
So if you're experiencing weakness,
Mm.
like foot drop.
What is foot drop?
So foot drop is where you can't lift your foot up.
Oh, okay.
So you kind of have to lift your leg up high to walk.
Yeah.
Or if you can't stand on your heels.
Oh, great.
Those are red flags.
Okay.
That's when he advises seeking medical attention immediately.
Because it could indicate a need for surgery.
Right.
Got it.
Because those are signs that there might be some nerve damage.
Right. It's not just pain. It's like your body's ability to function
Yeah.
properly.
Okay.
It's about function.
Got it. Okay. Well, that's really good to know. So those are the red flags. But for those of us who are dealing with pain, let's say, we're not maybe in the emergent needs surgery category,
Right.
but we're still having pain. What are our options?
So this is where I think Dr. Katzman really shines because he offers a very empowering, patient-centered approach.
I like that.
So he's not just saying like, okay, you have a herniated disc. Here's the surgery we're going to do.
Right.
He's saying, okay, let's look at all of your options. Let's figure out what's going to work best for you,
Okay.
and let's come up with a plan together.
Yeah.
So he has what he calls a treatment trio.
I love that, the treatment trio. Okay. And these are basically 3 different approaches
Okay.
that he uses to manage pain.
Got it. And what's the first line of defense?
So the first line of defense is always going to be medications.
Okay, makes sense.
And this can range from, over-the-counter painkillers
Okay.
like Advil or Tylenol
Hmm.
to prescription medications like gabapentin.
I've heard of gabapentin.
Okay.
What is gabapentin?
So gabapentin is a medication that's used to treat nerve pain,
Okay,
and it works by calming down the overactive nerves
got it.
that are causing the pain.
Okay.
And then depending on the severity of the inflammation,
Mm-hmm.
he might even suggest a short course of steroids.
Like a Medrol dose pack or something like that?
Exactly.
Okay.
Just to help reduce the swelling and the pain.
Okay, that makes sense. So we've got the pain management covered there.
Right.
What's next in this trio?
Next up is physical therapy
Oh,
with traction.
traction. Now I'm picturing like the old school head braces.
I know, laughing.
Like, what is traction when it comes to this?
It's much more sophisticated nowadays.
Okay.
But basically what traction does is it gently stretches your spine
Okay.
to create more space and relieve pressure on those irritated nerves.
It's like giving your spine a little breathing room.
Exactly.
Got it. Okay,
Yeah.
that makes sense. And then the final element of this treatment trio are injections.
Precisely.
Okay.
And specifically epidural steroid injections.
Okay, and remind me what those are again.
So basically, with an epidural steroid injection,
Mm-hmm.
the medication is delivered directly to the area around your spinal cord,
Okay.
providing targeted pain relief right at the source.
Wow, it's amazing how targeted treatments can be these days. That's really incredible. And I appreciate how he emphasizes that these interventions aren't mandatory.
Right.
It's all about having options.
Exactly.
Yeah.
It's about what's right for you
Yeah.
and your body and your lifestyle
Yeah.
and your preferences.
Well said.
But of course, there are times when surgery becomes the most viable option.
Yeah, and it sounds like, he doesn't shy away from that at all.
Right.
But it's a last resort in his mind. And he talks about this procedure called a minimally invasive discectomy.
Yes.
What is that?
So basically, with a minimally invasive disectomy, it's a much smaller scale procedure than a traditional open back surgery.
Okay.
So instead of making a large incision in your back,
Right.
he would make a very small incision about the size of a quarter.
The size of a quarter. Wow.
Yep.
That's incredible.
And he would use specialized instruments to remove the portion of the disc
Okay.
that's pressing on your nerves.
Wow. Okay, and then what's the recovery like?
And that's one of the biggest advantages is that it's considered very safe.
Okay.
And patients often go home the same day.
Same day discharge.
Yep.
Wow, that's amazing.
Which is a huge game changer.
Right, because then it makes surgery seem a lot less daunting.
Exactly.
Right, because you're not laid up in the hospital for days on end. You're in and out.
Yeah.
It's much less invasive.
Yeah.
It's much quicker recovery time. That's incredible. It's amazing what they can do these days. And, I think one of the things I really appreciate about Dr. Katsevman's perspective is this emphasis on really, exploring all other options before even considering surgery.
Absolutely.
He really sees it as a last resort.
Yeah.
And I think that that's a really responsible perspective for a surgeon to have.
I agree, because I think there is sometimes this pressure to jump into surgery right away.
Right.
But he's really advocating for a more conservative approach,
Right.
which I think is really refreshing.
Well said. And it really, I think, prompts all of us to be, more informed healthcare consumers.
Absolutely.
Right? Advocating for ourselves,
Agree.
exploring all of our options, and really understanding, what those options are and what the potential risks and benefits are.
Right. Because knowledge is power.
It really is, especially when it comes to your health.
Especially when it comes to your health.
Well said. Well, if you are dealing with back issues or you are just curious about this very common condition, keep learning. There's so much information out there, and we will keep bringing you these deep dives so that you can feel empowered to really take control of your health
Absolutely.
and advocate for yourself.
Yes.
Thanks for joining me on this deep dive,
Of course. Thanks for having me.
and we'll see you next time.